My name is Chris Hill. I'm the chairman of the board and CEO of CindyXR. Welcome to our wellness journey. I'm very happy and pleased to have two very important parts of the medical community here coming from different parts of the world joining us on today's journey. The first is Dr. Sabeen Amir. Dr. Amir is a senior general practitioner at Prime Medical out of Dubai, United Arab Emirates. Welcome to the wellness journey, Dr. Amir.
Thank you. Thank you so much for giving me the opportunity to come and have a chat with all of you today.
Well, it's great to see you again. And also, Dr. Charles Cabo. Dr. Charles Cabo is a co-founder and chief medical officer of Pounds Transformation here in the United States in beautiful Connecticut. Dr. Cabo, how are you, sir?
Hey, I'm doing really well. Thanks, Chris.
Good to see you again. Well, let's get started. And what I'd like to do, before we get into, we talk a lot about some innovation that's happening in the marketplace, but I want to stop for a second and talk a little bit about Dubai, the United Arab Emirates, and that whole region, Dr. Mir. You know, it's very interesting. I've had the pleasure of traveling in that area quite a bit, and I've been really struck by the commitment it's made for medical innovation. Obviously, over the course of the decades of medical investment, and certainly in your experience through Prime Medical Center, you've seen a lot. You've seen a lot of innovation that's happened. Can you take us back to when you were first getting involved in that area, and what type of growth have you seen? There certainly seems to be a real commitment around medical excellence. Not that we don't have a lot of work to do, but take us a little bit into your area of Dubai. What's it like being a medical practitioner in that area?
Well, certainly it's not that easy because you do get, Dubai is a place where you get people from every part of the world. So yes, it's been a wonderful journey so far. I mean, we have seen that the expertise, I mean, how the change has taken place. The AI has been taking over a lot of the medical field also. Slowly, we have seen the transformation, especially in the radiology department, that people are actually incorporating the AI into the reading of the X-rays and the MRI scans that is coming into place. And slowly, I think this is going to take over the medical field to some extent. But yes, human touch will always stay there. Another thing that we have seen where I'm concerned as a general practitioner is the awareness about the lifestyle medicine. What I also specialize in is the awareness that is coming amongst people now, that how your lifestyle factors that can actually affect your disease, how it can actually affect your health. And it's very nice to see a lot of conferences are now being conducted not only in Abu Dhabi but in this Middle East area like Qatar, Pakistan. A lot of places are slowly coming forward and actually realizing that yes, this is the core thing of the medical field, basically.
And it seems to be a long-standing commitment that's coming through a combination of government investment as well as obviously private sector investment, some real long-standing plans that may reach out into decades as we move forward. Do you get a sense of that sustaining commitment made to the medical community and the medical business?
Yes, it is there, but slowly it will take a while because obviously there are a lot of things happening where the what you say, the AI and everything is concerned. So it will take time. Yes, the medical field is pushing it forward and the government is realizing that that is the way forward. So yes, they are collaborating together to make this happen for the benefit of everyone.
I know that you recently attended you're part of the Royal College of Physicians, and there was a recent event a few months back in Dubai with some of your medical professionals in the region, and talked a lot about the things that you've touched on, such as artificial intelligence and other type of technologies being applied to your medical community. Can you tell us a little bit about the effect of AI and some of that investment in new technologies and how that's changing the care within the region?
So a lot of technology is coming up in the sense that where the investigation is concerned, where where catching a disease is concerned, where MRI scans are concerned, especially where the what we say the abdominal diseases are concerned. So a lot has come forward where the endoscopy, where the MRI, CT scan is concerned, heart disease are concerned, CT scan scoring, everything is coming forward. A lot has come forward where the cancer related thing is concerned. I mean, there are a lot of which has been happening, a lot of innovation has taken place, a lot of researches has been going on where doctors or researchers are coming forward with new medications everywhere. A recent one is, you can see that which has taken the world by the storm, is Mounjaro and Ozempic, which is doing wonders now. I mean, people are, it has proven very well, I mean, quite a lot in where the weight loss is concerned. So yes, slowly and gradually we are getting there.
So, Dr. Cabo, let me turn to you as the co-founder and of Pounds Transformation and the chief medical officer. Some of the stuff that Dr. Amir is referencing, be it technologies, this high focus on wellness as opposed to perhaps this sickness. I know is something that's very close to you and your team at Pounds Transformation. Can you talk a little bit about your background at Pounds and the evolution that you've seen here in the United States around some of these topics that Dr. Amir has brought up?
My background is in OBGYN, so I practiced OB for over 15 years. And while I was doing that, my patients, despite efforts of just traditional medicine, were getting sicker instead of healthier. And it was certainly obvious that we could do a much better job with just primary prevention of chronic illnesses. And so there was a pivot that I made in my career after my wife started a medical practice that was really geared towards weight loss and management strategies around things like type 2 diabetes that dealt more with nutritional medicine and lifestyle medicine. And it had become incredibly successful. And rather than prescribing medications, she was de-prescribing medications and watching people get better. And that seemed to be an appropriate pivot for me to make in my career. So I joined forces with her, and her practice that she started with 2 patients in her kitchen grew to 3 offices and hundreds of physician referrals into the practice, and a spot on Netflix international documentary just discussing and introducing how powerful food, nutrition, lifestyle could be when managing different disease states. So with regards to where I am now in my practice and opportunities that I see, I've started to really embrace functional medicine, which is, I think, on par with lifestyle medicine, which kind of drew me to this conversation. So I'm just looking forward to learning more about that aspect of the practice that is going on in the Middle East and seeming to grow very quickly, and how it runs parallel to what we're doing in our practice with regards to understanding root causes of the different problems that we see and management strategies of those causes, rather than putting the band-aids on the bullet holes of disease with different medications.
Dr. Cabo, and this is a question I'll put out to both of you folks. We live in an age, we reference artificial technology and artificial intelligence, better stated, where the learnings are coming quite fast. We're seeing a situation, you mentioned the A1C treatments and the protocols and the drugs such as Ozempic. I guess my question is, how do you guys keep up with your learning? You mentioned going to, when perhaps in the past we'd go to perhaps some of these events and attend the Royal College or Physicians event or do some of the events that you do, Dr. Cabo. But the market is moving so fast. The learnings are coming so fast. How do you, in this day and age of 2025, keep up with all these innovations, keep up with the learning approach and the pace of information? And either one, you could take it to maybe start with you, Dr. Amir.
Well, obviously it's very hard, but I think for me what I feel is that yes, you have to keep going back to your guidelines and everything. There are different websites where the nice guidelines are concerned, American guidelines are concerned, but I feel that your patients teach you, end up teaching you quite a lot, because that's where from your learning comes from, and the patients come to you with different aspects of their life, and it's not like a textbook presentation always. So for us, when the patient comes to you, you tend to learn on them, and that's how we go forward, like actually researching, learning. And like Dr. Cabo just mentioned, it's not only about the disease itself, it's actually getting to the root cause of the disease. And that's what our main aim is basically. I mean, you can cure the symptoms that the patient is having, but till you don't cure the root cause, the patient will keep coming back to you again and again.
Dr. Cabo.
Agree with everything she said. One of the best resources for learning is by listening to your patients. And we have we have requirements to do CMEs and continuous medical education, which is coursework, testing, articles that are up to date, and that sort of thing. And certainly the CME coursework that you do is an opportunity. And then I just think plain old curiosity. And when asked a question by a patient and not knowing the answer and feeling like you need to refer them to somewhere else, I think that a lot of times if you have curiosity, you can find the answers, especially with technology the way it is and the assistance of AI. Many people can discover answers to questions that they might have and continue learning appropriately, given the technology that we have available now at our fingertips.
You both mentioned the role of the patient and in some ways educating you, which I think is fascinating and it's very enlightening with respect to that. If you could put your shoes, your feet in the shoes of the patient. So we're in a world where the patient themselves are learning very quickly through search engines and now through AI. As you look at how they're evolving and their approach to healthcare, and frankly, their levels of education based on their own research before they come and visit you or as they work with you. How has that evolved? Is there, there's probably good news and maybe there's some bad news around the level of patient education, or is it all good given the available of information out there? Are there any cautionary tales, or is it, are the patients coming in as more informed consumers perhaps of your service?
I think there's a good side and a bad side. Patient comes and they actually have a symptom. What they do for initially, they used to go to Google and search all the symptoms. Recently, they have gone to ChatGPT. They will just put their symptoms, everything, differential diagnosis, everything. Treatment plan will come up. Then they will come to you. The good side is that sometimes even if a minor symptoms or something that has been prolonging for a very long time, instead of like ignoring it, they will come to you and you are able to treat them or catch the disease in time. But sometimes what happens is they will come, they will have read so much about it and they're so adamant about it, okay, no, that they have got it, that it kinds of make them very nervous and very agitated, even though the problem is not that big. So for us, it's like we have to fight the battle both ways. I mean, there's a good side to it and there are bad sides. That means too much knowledge is also not good for the patient, because it takes us a lot of energy to actually explain to the patient, okay, this is not what is happening and this is what is happening and this is how you're going to deal with it step by step, and you don't need to jump directly to this. So we will take it one step at a time.
Scenario happens here. Sometimes it makes our appointments more efficient because there's less explaining to do if they've got they put their symptoms in, have the right diagnosis and plan, and you just agree and provide a little more education. And sometimes you have to do some backtracking. So double-edged sword, I guess, throughout the day.
Well, as you both know, at CindyXR, what we do is bring your patients together under your tutelage and oversight, of course, to communicate amongst themselves about their condition, about best practices, to ultimately support each other and to learn from each other. And we've seen that the value of that. If you were able to speak to some of your patients, after they leave you from an appointment perspective and before they see you the next time, What is some of your advice to patients? How do you help patients help themselves once they leave your office and before they meet you again, in terms of adopting best practices in this age and embracing perhaps even the information and technology? Is there any sort of best practice or advice that you give to your patients as a way of them learning in a constructive manner?
See, for as a general practitioner, what I always tell the patients is like your disease, if it is coming forward, it is in your everyday routine. There's something which is desynchronized, which is causing the problem to happen or the symptoms to come up. So you need to catch those things first. Okay, it's all right to Google, it's all right to learn what it is, but you need to backtrack yourself and find out where in your daily habits, where you have kind of gone off the track. Now, where I deal with is the lifestyle medicine, and I tell them very simple rules. You have to look at what time you're sleeping, how much sleep you're getting, what is your exercise level, what you're eating, how frequently you're eating, if there's any substance abuse in the form of smoking or any drugs that can cause this to happen. So it's a very simple thing, and all they have to do is either they can, even on the mobile phone, take notes of themselves or maintain a diary to keep a track of what is happening, what is causing the symptoms, and that goes for everything.
And Dr. Cabo, I know you've always taken an approach of wellness with your patients and taken sometimes contrarian, but also very smart education for your patients. What are some of your best practices that you leave patients with after they see you on a visit?
So pretty much the same thing that Dr. Amir just said. I think about the top sort of 3 or 4 buckets that patients don't need me for if I give them the right tools. So food, sleep, movement, exercise, and management of stress. So I think with those 4 aspects under control, or at least moving in a direction to improvement, patients can take their health into their own hands and be managers and directors of how healthy or unhealthy they're going to be next time I see them.
And Dr. Cabo, do you see the real adoption? Have we gotten beyond the sort of early phases of the hype curve around wearables, where people are actually using A1C monitors? They're actually embracing technology on a sustained basis, where they are becoming more aware of their particular biometrics, and that's helping you as you're interfacing with them. Are they really adopting these wearables now on a sustained basis?
Oh yeah, we definitely and we appreciate that that technology that patients bring to us, especially things like continuous glucose monitors, things like heart rate variability, the information that we as clinicians in a space of primary prevention can gather from those kind of devices and then educate patients with regards to what they can make of the data is extremely helpful.
And Dr. Amir, in your region, in Dubai and various places within the region, are you seeing a similar adoption of wearable technologies and the use of the data to help with patient education for their own bodies and healthness?
Yes, I think one of the main things is the smartwatches which has come in, because a lot of patients, what they are doing now is they're monitoring the stress level also, the sleep patterns also, surprisingly, and their heart rate. And if they feel that the heart rate has been high for a very long time, they do come to us. Okay, I've noticed that my watch has been giving me notifications that my heart rate is elevated for the past 1 week. So over there, if we feel that we need to do any investigations further, look deeper into it, it does help us. Plus, even if there's no underlying pathology, what helps us is like maybe reading, maybe the patient is very stressed out, so we give them the basic tools like we just discussed earlier, that how to manage your stress or how to control it with your daily habits, and it helps them quite a lot. Another thing is the device which has come in, where you implant it and you monitor your sugar levels throughout the day, and a lot of patients have been utilizing that. They're saying that they have put that on, and they have realized how certain foods give them a certain spike, and they are able to now control their habits quite a lot. So I think in diabetic patients that has served quite a purpose, because they can actually themselves monitor, if even if like a small thing, like a small helping of rice. For normal people it might not, but for a diabetic patient it's just a small like a handful or like a small bowl of rice will give a huge spike for them. So yes, it certainly has helped them quite a lot.
And with their sort of their own behavior modification, that's really interesting. The information that's coming back, and the devices now are becoming quite affordable. Even now, we're hearing maybe to the point where you're getting that level of scalability, and that's great. Well, let me just sort of finish up. When we're talking about technology, maybe we can put our futuristic hats on, and there's a lot of interesting. There's been a lot of people that a lot of studies that have come out, and now with new technologies around various things, we're seeing certainly with some level of vaccinations, but also just other technologies that are coming out that may ultimately provide hope for around some diseases that have not been heretofore as curable. As you look at the future here, as we now expand beyond the next maybe 5 years, God forbid 10 years forward here, what are some of the technologies or some of the innovations, let's put it that way, that you're seeing that you're particularly excited about, perhaps that aren't being talked about now, or that are being talked about, but ultimately that you're quite excited about? So let me start with you, Dr. Cabo, on this. What are some of the things that you're reading about that we should be very interested and excited about that's going to change healthcare over the next 5 to 10 years if you have your futuristic hat on?
Well, there's so much stuff in the pipeline. It's hard to know where to begin, but hopefully, from where we are today and where we're going, there'll be improvements in diagnosis, earlier detection, screening of cancer, so that we can have strategies that aren't so much geared towards losing battles in metastatic cancer, but we're winning the war with regards to screening modalities and earlier detection and management of cancer. I think that's a space in medicine that we really should demand improvements. And the other aspect of medicine, hopefully in 10 years, we'll have a lot better answers to understand, prevent, or manage dementia and Alzheimer neurogenic diseases. I think we're starting to see signs of science cracking that code, but we're not there yet.
Dr. Amir, I've seen you nodding your head. I'm going to give you the magic wand here. You're going to wave it. What does it look like over the next 5, 10 years or so? And what do you see as potential, or medical changing trends that are happening that you're excited about?
I will agree with Dr. Cabo on this. These are the two fields that we really need something substantial to happen in the near future, and I'm really looking forward to, because what I have been reading, a lot of researches have been done, and they are trying to come up with some system where the early detection of cancer can take place, or where they can freeze the cancer cells and it can decrease the mortality of the patient, especially also in Alzheimer's. There's one thing, Parkinson's. These are the fields where work has been done, and I'm hoping that in the near future there will be a breakthrough.
Well, just to finish up on this early detection movement, because it's interesting you're both talking about that. Me as a patient, a civilian side, just recently had a scanning looking for things that may be happening, and now you're hearing about full body MRIs and that level of detection. I know there's some controversy around that. Luckily enough, I have nothing to be concerned about at this point, but the whole idea of actually doing a wellness check proactively, and I know there's always a concern about false positives and things like that. Is that something that you both think that patients really should be leaning more into? Is that helpful?
Go ahead, Dr. Amir.
Yeah, no, go ahead. That's fine.
No, you first. I did it last time.
Okay, So yeah, a lot of health packages has been done. Like even in our clinics, we do health package where all the basic baseline investigations are done. And sometimes, without even knowing, the patient might be thinking they're healthy. They do come forward that something comes up in those tests. So there's early detection which helps that. And like we said, in those early detection, it's very easy to reverse the progression of the disease. We can normalize those. And like we said, like we already talked about, like wellness approach in the simple, basic 4 or 5 rules of like lifestyle medicine. We talk about your eating habits, your exercise, your movement, your stress management. They can help reverse these diseases at an earlier time.
Dr. Cabo, on early detection?
Yeah, I mean, I don't think there's anything wrong with patients going out and getting their own kind of screening or ordering their own labs through different kits that are available now online. Unfortunately, it's cost prohibitive for a lot of people that, full body MRIs that detect what I would call incidentalomas sometimes create treatment strategies and anxiety with regards to what's found. So I think it's an interesting space, but it's not one that I would push my patients into spending their dollars. I think there's better strategies for how they can use their money to promote health and wellness.
Excellent. And as we finish up our session here, I'm just struck by the level of communication between you two in particular. The kindness, the sharing back and forth. I guess my question is this: how are physicians in this day and age doing in communicating with each other? Do you feel like there is a good level of communication from professional to professional? Are they utilizing things like social media and other ways of communicating, not just with their patients, but with each other? And also, if there's any questions that you have for each other, feel free to put them in there before as we finish up our session today.
Well, we
Communication.
do,
I think the
yeah.
communication between physicians and providers is more robust than ever with EMRs, electronic medical records, and the connectivity that we have amongst each other. We can get information about patients or give informations about patients very quickly now with EMRs and where they're at and access points. So again, I think that we're in a very good place right now with communication.
Yeah, I will agree again with Dr. Cabo that yes, the EMR helps quite a lot. And obviously, if there's anything which has to be personally conveyed, you always have the professional email of the doctors. Plus, over here, in what the way they are trying to do recently is they're trying to connect the records of all the patients on one unified platform. So that is helping us quite a lot to actually, even if the patient is coming to us for the first time and he doesn't have the records, because normally in the olden they used to have sheets or sometimes they don't have it on the phone. For us, it's very easy to go to that portal and see what investigations were done in the previous, or is there anything that which has changed or anything which has become progress or gone better. So it's really helping us that way.
Excellent. And is there any, we have obviously it's great communication here between Dubai and New York, Connecticut. Are there any misconceptions or is there anything that people get wrong about how medicine is applied in, in the Middle East or in the Gulf states versus in the United States? Is there anything that we need to do to help further the communication, or do we need the communications very well? The misconceptions are low, and we're all learning from each other. We'll start with you, Dr. Cave, with that, and we'll finish up with Dr. Amir.
I mean, there's always room for improvement in anything, I think. And so sometimes the misperception that I see patients have that leads to some anxiety and stress in our encounters would be that just an assumption that because they had a test, we have access to it. A lot of times that's not the case. So a patient could have a CT scan or MRI or blood work done at one lab that, patients think that the results just come right into the electronic medical record system. And unfortunately, while I wish it would work that way, it doesn't. And I know that, efforts are being made to improve that, but definitely we're not there yet with regards to really just streamlining information as soon as results are populated into the offices so we can discuss it with the patients.
And Dr. Amir, just to, last to you, that may be a universal concern that physicians you have. You may have that as well. Is there anything cross-cultural or cross, as you think about the various ways that medicine is being applied, any misconceptions or anything that you want to end up our session with that we need to be aware of, or do you need to clarify?
I think we doctors are connected with each other in a lot of ways. Okay, so like we said, when we do attend the conferences and when we do have those CMEs where we do attend to, all the misconceptions we do tend to clarify during those meetings and during those conferences. So yes, there's still room for improvement, but we are getting there.
Well, we certainly are, and I think you've both furthered our education and knowledge of what's going on in the medical community today, and things to get very hopeful about as we look to the future. So I just want to say thank you to both. We appreciate for our community here at CNXR how you're really dedicated, particularly around patient education involvement, and we wish you both the best. Thank you for joining us on our wellness journey today.